My name's Herb Riemenschneider. I'm a urologist. Let's talk about erectile dysfunction. The issue can be either total inability, which means that you can't get an erection at all, or you may have the ability to have an erection, but you can't sustain it. Roughly 50% of the people between the ages of 40 and 70 have erection dysfunction. The causes for erectile dysfunction, for our purposes, for the most part, are physical. So let's talk about how an erection occurs. The problem is that this is an autonomic reflex. It comes on involuntarily. It comes when there is certain types of stimulation and excitement, and you can't make it appear at will. What we're really seeing is the erection going from a flaccid to an erect state in a normal individual. And through the interaction of the brain, the heart, and blood vessels, and the input of erotic stimulation, certain chemicals are generated. This is the flaccid penis. This is what we call the erectile body. These are nerves, veins, arteries, and it's a relationship between these structures that allow the erection to occur. So how does this happen? Nitrous oxide interacts with this chemical that is present in high concentration in the erectile tissue. It produces this compound, cyclic GMP. It causes the muscles in the corporal body to relax. Here's the situation when the penis is flaccid. There's a good flow of blood coming into the penis, and these muscles are contracted, and there's a good pathway for the blood to flow over and around and out the venous channels. But when the chemicals that I was just talking about are produced because of sexual arousal, these muscles then relax. And when they relax, they tend to increase in their volume, and you can see that the arterial blood coming in is not draining out nearly as efficiently as it was. And this is when the erection normally occurs. Now this is the normal sequence, but it's important because there's ways that we can deal with this when it's not working properly. Erection dysfunction can be an early sign of vascular disease throughout really the whole body. Testosterone. We want you to understand that there's a number of areas where it is very vital to our health. Clearly, it influences our sexual function. We're beginning to understand that testosterone has a broader application of benefit than we've previously given it. And we also know that as we get older, levels of testosterone diminish. So how do you access testosterone? More recently, there are pellets, and these are implanted under the skin, and there's a delayed release of testosterone over a period of time. This is called Testapel, and it can be implanted relatively easy in the office environment. Viagra was the first product. Remember, I showed you early on, and this is true for all the 5 phosphodiesterase inhibitors, I showed you that cycle. And at the bottom was phosphodiesterase. The problem that you have when things aren't working is that the chemical is being broken down by the diesterase. Well, Viagra, Cialis, and Levitra are inhibitors, so they slow that breakdown, and the cyclic GMP builds up, and that's how those drugs work. Well, this is injection therapy. Now, there are medications that we use called Bimix and another called Trimix. You can create erections with injection therapy that just weren't there with the pills because the dosing can be higher. And for the most part, what I found is patients who respond to higher doses find that although at first blush the injection may be a turnoff, but once they find out it works for them, now that's a different story. So clearly there are good medical strategies to deal with the problem. Penile implantation. In many ways it's thought of as a last resort. And I disagree with that concept because I think there's times where people settle for less than they could have for too long. There isn't enough blood flow to really make this erection system work. Venous leak. That means that the vessels, the muscles within the penis don't react appropriately even when the right chemicals are present. They can't occlude the outflow of blood, so even though the blood may come in at good velocity, it leaks out faster than it can be accumulated. So all of these are indications for the penile implant. These are cylinders that fit into the erectile bodies. This is a reservoir that goes behind the abdominal wall, and this is a pump that's in the scrotum. This is Coloplast's model of an inflatable penile prosthesis. Now, I'm showing you this just because I want you to understand that the penile prosthesis is totally implanted. The erectile tissues here are what's not working in our hypothetical patient. This is where the cylinders go. The pump in the scrotum and the reservoir, and it's all inside. There's nothing that you can detect or know about on the outside. This is representing the Coloplast Titan. This gives you the ability then, even if you have disability from fibrosis or other vascular problems, that you can recreate the circumstance of a good quality erection, and even more important, it's on demand.
To simulate an erection. To transfer the fluid to the cylinders, locate the pump in the scrotum. Squeeze the pump firmly a few times between the thumb and fingers until an erection is achieved. To return to a flaccid state. Fluid pressure in the cylinders is released when the patient momentarily depresses the deflate valve button to enable fluid to return to the reservoir, thus returning the penis to the flaccid state.
Really works. You just have to have the right set of circumstances for that to be a benefit. And we work really hard to match up the right patient with the right solution.